Good afternoon, all. Thank you all for coming here to Medicover Women and Child Hospitals. I'm with my team here, cardiac cardiologist, cardiac surgeon, cardiac anesthesia, pediatric surgeon, and my registrar. We'll go into detail in a bit, but we are very proud and happy to share regarding a patient who came from abroad with a complex medical and surgical problem and who is going home successfully. We would like to discuss about that child in detail. Before that, I would like to brief about our current services available in this unit at Madhapur. We all we have qualified, highly trained consultants and nursing staff. Our infrastructure is modern and high-end. So, if you look at the services, we have NICU services, which is level 4. We have 25-bed unit. We can cater babies with all complex medical and surgical problems, including babies with heart problems. PICU, that is pediatric intensive care, we have 8 beds and we are capable enough to cater all complex children who come to emergency department or PICU with complex medical problems. Cardiac ICU, we have very qualified team here. We can deal with all medical cardiology and surgical cardiology, starting from newborns to pediatric age group. We have qualified, experienced pediatric surgeon who can deal with all pediatric surgery related problems, including newborn surgeries and urology. We have other consultants who help us and in other various specialties like pulmonology, endocrinology, neurology, etc. We have experienced obstetrics and gynecology team who can deal with any deliveries or complex deliveries, both preterm and term babies. We have experienced in-house radiology team. We also cover transport facilities. That means we have 24/7 transport services for both neonatal newborn babies and pediatric children, where we go and retrieve them from various hospitals in Hyderabad and outside Hyderabad, which is led by the pediatric registrar and the specialist team. So this is in brief about our unit, and I'll hand over to Dr. Ashish, our senior cardiologist, pediatric cardiologist.
Hello, I'm Dr. Ashish Sapre. I'm consultant pediatric cardiologist in this unit. So I just want to brief you about this case. You can see the picture over here. This case I have seen in Tanzania, our outreach OPDs, international outreach OPD. So this child is 16 months, came to our OPD there. You can see that it is there is a large defect in the anterior abdominal wall, and all the organs are actually coming out from that defect, and they are covered with only thin membrane. You can see the liver is there, large bowel is there, gut is there, stomach is there. Okay, and next please. You can see this. Okay, next please. Click on that video. Click on the slide, please. Click on the slide. We can say this child has survived 16 months. Now this condition is basically called as pantology of Cantrell. It is a very, very rare condition. Literature says around 1 lakh live births, one child will have this kind of condition. There are many components of this. I'll brief out the main components. There is a deficient anterior chest wall, means the bone which is called as a sternum is not developed. So whatever contained inside, that is the heart main content. It is exposed directly under the skin. You can see the beating heart there. Can you show the next video, next slide? So that heart will be visible beating there. Then there is a muscle layer between the thoracic cavity, that is our chest, and the abdomen, which is called as a diaphragm. So there is a big cleft there, big defect is there. Through that, all heart is actually prolapsing into the abdominal cavity, and then this cleft is extending into anterior abdominal wall. So all the abdominal contents are also coming out. So this is a very rare and complex condition, and treatment is also difficult. In this child, there was in heart inside also there was a problem. Normally we have two ventricles which are pumping the blood, one in to whole body, oxygenated blood, and other ventricle is pumping the deoxygenated, that means blue blood, to whole of lungs actually. So this child had only one functioning ventricle. Plus this child has problem in his pulmonary artery, which is taking the blue blood to the lungs. Can you show the next picture, next slide please? Next. So this is the normal heart. Next. This is how the normal circulation in our body. And this is the condition of this child. You can see that there was a pulmonary atresia. Next. And this is the live video of that child. You can click on that one, middle one. So this child was having oxygen saturation of body around 65%. Normally we have more than 95%. After COVID, everybody is aware that what is the saturation. So this child was surviving till 60 months on 65 saturation, which is very detrimental to the life. Child cannot survive for long with this kind of saturations. So this child was surviving only on an alternate blood supply to the lungs, which was also restricted. So this was the intracardiac condition. Abdominal condition, Dr. Madhu will explain you what are the issues were there. So overall, this is a very complex condition which can be treated only in a setup where there is a pediatric super speciality setup is there, and they work in a collaboration, and then they can treat this kind of condition. So when I saw in Tanzania, actually I had an experience of treating this kind of babies previously. So I knew that how to handle this kind of baby. We brought the baby here after a lot of deliberations. With all the government setups in Tanzania, we got the baby here and we convinced them for the surgery. We did the surgery. They will explain you about the details of the surgery, how we did it. So basically, intracardiac surgery, what we have done is a Glenn procedure we have done, where we have connected the superior vena cava, which is bringing the blue blood from the brain to the heart. We have connected directly to the pulmonary artery. So now the saturations, what it was 60s, now child is saturating around 90%. This child will require further cardiac procedure in the future after 6 years. So this is the brief what the child came to us, and now what is the condition of the child. We'll show you the child also. Hand over to Dr.
Pediatric cardiac surgeon. This is I will say, this is a very rare anomaly. Very few surgeons will get to see this case in their lifetime. And apart from seeing, to treat this is still rare. And successfully treat this is still rare. Because whatever treatment is done, many of these babies do not survive the surgery. We are very fortunate that we have the team and the paraphernalia to treat this condition, and we operated the kid and the baby is going home. Regarding the heart defect, it was an anomaly which is quite common, I should say. The lung supply was very restrictive, and we had to restore the blood supply to the lungs. Apart from that, the left pulmonary artery was smallish, so we had to increase the size of the left pulmonary artery. The entire surgery was done in a single sitting. The cardiac defect was corrected, the abdominal wall defect was corrected, and the covering of the heart was given. It took around 8 to 9 hours for the entire surgery. He recuperated well in the ICU, and he was discharged from the ICU to the ward on the 5th day. And presently he is fit for discharge. So it is all a team effort which has given rise to this kind of success. and we are thankful for that.